After the injection, you will likely be prescribed a regularly scheduled monitored program of trunk stabilization. Some or all of the following exercises may be included. Before exercising, a heating pad is often placed at the lower back to relax and warm the muscles. After 10 minutes, you will be ready to begin. The first exercise is called the dead bug. Lying on your back with your knees flexed and feet flat, you first push your lumbar spine toward the mat, exerting only a moderate amount of pressure on the therapist's hand. Then you will raise one leg at a time, making certain that you exert the same amount of abdominal force while holding your leg extended. You may be asked to alternate legs or arms. You may also be asked to extend or flex your foot. As you progress, you may be asked to do this exercise with weights on your legs or arms. The dead bug exercise is the first of several exercises designed to stabilize and strengthen the muscles of the spine. Lying on your back with your knees flexed and your feet flat, you first place your arms across your chest. Then you gently raise your shoulders and back off the floor while maintaining a neutral, pain-free position. The speed at which you do this exercise may vary, as well as whether or not you add movement designed to engage the oblique abdominal muscles. Either way, maintaining a neutral, pain-free position is the key to increasing abdominal tone and strength. This exercise is again performed lying on your back with your knees up. With your arms to your side, you begin by lifting your hips only 1 inch off the mat, always careful to maintain a pain-free, neutral position. Then you raise your hips further off the mat to the maximum height allowed, always mindful of keeping your trunk and hips aligned. Remember, this is not a back-arching exercise. It is important to maintain trunk control throughout the duration of this exercise. For the prone exercises, your therapist will ask you to lie face down on the mat with your arms and legs extended. A pillow may be placed under your abdomen to prevent too much lumbar extension. Then, while holding your abdomen in a neutral, pain-free position, you slowly raise an opposite arm and leg off the mat. You hold, relax, then repeat with the other arm and leg. The quadruped exercises are performed on your hands and knees. In this all-fours position, you then tighten the trunk musculature and hold the spine in the neutral, pain-free position. Extend one arm and the opposite leg, hold and relax. As before, repeat with the other arm and leg for as many repetitions as your therapist asks. As you progress and gain strength, you may be asked to complete this exercise with the use of weights on the extremities or with a balancing bar across the back. The wall slide exercise is performed with the aid of a large inflatable ball positioned at your back. With your legs slightly apart and your arms at your side, you gently bend your knees, rolling the ball along your back as you imitate a sitting position. At first, you may be asked to perform this exercise with only a slight bend in the knees. However, as you gain strength, you may descend all the way to a full 90-degree hip and knee flex. Again, using a large inflatable ball, this supine exercise is a low-impact quadricep press. With the ball placed in the small of your back and keeping your chest and stomach tight, gently roll back on the ball by straightening your legs. Keep your chin tucked in so as not to strain your neck. Keep your back in a neutral position and your chest up. Return to the starting position by bending your knees and rolling back down the ball. Aerobic exercise is another important part of your physical therapy. So as not to overstrain any one particular muscle, a variety of activities are recommended, from the treadmill to the stationary bike to swimming or walking. Finally, after you complete your physical therapy session, a cool pad may be applied to your back to soothe and relax the muscles. Your physical therapist will supervise all treatments. As you progress through these exercise levels, you will find not only relief from your back or leg pain, but strength and flexibility as well. Again, the injection will take your pain away, but it is the physical therapy that will keep your pain away.